Well, good afternoon. We'll go ahead and start first with an update on the numbers from this morning. Today, we have 66 new positive cases, including cases in 3 new counties, for a total of 614 positive cases in 62 total counties. We have today 750 negative cases for a total of 8,054 negative cases. We do have the ability to test 1,018 individuals through the state hygienic lab. We have 74 hospitalized as of last evening. 144 have recovered, and I'm sorry to report that we have had 2 additional deaths for a total of 11 in the state of Iowa. Today, I am updating the proclamation of disaster emergency to extend business closures and suspensions of non-essential and elective surgical data and orthodontic procedures, provide additional regulatory relief, and continue the order to limit gatherings to 10 or less all through April 30th. I am also ordering that school closures are extended through April 30th. Keeping Iowa students out of classrooms is a very difficult decision, but it remains necessary for now. We anticipate the number of positive COVID-19 cases in Iowa will continue to grow, and keeping schools closed for an extended amount of time will help protect the safety of our students, educators, and school staff, reduce the burden, flatten the curve on our healthcare system and workforce, and of course, reduce the risk to our most vulnerable Iowans and ultimately save lives. At this time, I am not ordering schools to close for the remainder of the school year. As we have with all COVID-19 mitigation decisions, we will continue to monitor the situation, assess the measures that we have in place, and use data to make the right decisions at the right time. That said, it is also important that Iowa schools do their part to provide continuous learning opportunities for their students. And so many school districts have already taken the initiative to do just this, including rural school districts and private schools. I want to thank them for stepping up and finding a way to make this possible for their students and families that they serve. School districts know best what will work for their communities, which is why these decisions can and should be made locally. Making a sudden shift to virtual learning, it isn't always easy, especially during the crisis that we face now. But we can't let perfect be the enemy of good. There are a number of ways that schools can continue to engage students during this time, and it's each district's responsibility to do so. Director Ann Lebo with the Department of Education has been working proactively with the Education Task Force to develop a plan that defines options for continuous learning programs, including non-credit and for-credit options. School districts will be required to select the best option for the students and families they serve and inform the state of their decision by April 30th. School districts that choose not to provide continuous learning will be required to make up the instructional time lost beyond what has been waived by the legislature. I also want to let school districts know that while we extended closures through April 30th and we continue to evaluate the information, I know that it's also extremely important to you when you're making your decisions to give you at least a 2-week notice. And we will plan to do that as we move through this process. So at this time, I'd like to ask Director Lebo to provide more information about the plan. Ann?
Thank you, Governor Reynolds. The recommendation to close schools through April 30th was not made lightly, and we know the challenges that this decision puts on our schools and families. During these unprecedented times, we remain focused on supporting our schools, families, and community partners to ensure Iowa learners are safe, healthy, engaged, and prepared. Superintendents are preparing for next steps. Teachers across the state are sharing ideas and finding creative ways to engage with their students. And parents are juggling work and helping to engage their children in learning at home. To help public school districts and non-public schools accommodate student and family needs as flexibly as possible at this time, we are providing further guidance on school closures and continuous learning. Previously, we issued guidance that provided all Iowa-accredited non-public schools and public districts with 2 continuous learning options, and those continue to be in place. Those options, which were based on recommendations from the Continuous Learning Task Force and take into account student needs and district resources, include both a voluntary option and a required option. Under the voluntary option, schools can encourage students to participate but cannot require them to do so. Under the required option, students are required to participate, attendance is taken, work is graded, and credit granted. Under new guidance, all public districts and accredited non-public schools are now required to indicate which method of continuous learning they will use from April 13th through April 30th. They will have until April 10th to submit their decision. We have developed an expedited application process for any school that wants to implement a required continuous learning program. We encourage schools to work as quickly as possible on their plans, which may include the delivery of content through online learning, paper packets of assignments, or both. Accredited non-public schools may decide to provide required educational services without applying to the department for authority, but we ask that they indicate their decision to do so by the April 10th deadline. We will have the expedited application to provide a required continuous learning program available within a couple of days and are prepared to turn around applications within 24 hours. While we strongly encourage schools to provide continuous learning opportunities through one of these two options, they are not required to do so. Districts and accredited non-public schools may choose not to offer continuous learning, in which case the department will follow up to ensure that missed instructional time is made up in a manner that is appropriate in accordance with circumstances at that point in time. Please know that any district or accredited non-public school may combine voluntary educational enrichment opportunities and required educational services for different grade levels in any way that best serves the needs of their students. They are also welcome to begin with voluntary educational enrichment opportunities and move to required educational services later. I also want to point out a new educational resources webpage we launched this week that provides optional resources for families and educators to use as they support student learning during school closures due to COVID-19. The resources can be found on the Iowa Department of Education's website and include interactive games, virtual field trips, coding activities, and ebooks. I am grateful to our partners at AEA Learning Online, the Governor's STEM Advisory Council, Iowa PBS, and the Iowa Reading Research Center, who worked with us to make this research page possible. Our team at the Iowa Department of Education is committed to supporting our schools and educators as they implement creative educational solutions during these challenging times. To do so, we will be surveying our schools to identify and address barriers they face in implementing continuous learning programs. We know that professional learning opportunities, along with uniform, consistent Wi-Fi access for students, top that list. We're working with Governor Reynolds, Iowa's AEAs, and other partners to coordinate efforts so resources are in place. The department will continue to be diligent in our efforts to ensure we have the supports available to provide local school districts with the flexibility to best address the needs of their students, families, and communities. We know there will be challenges throughout this process, along with much uncertainty, and appreciate that everyone is working hard to ensure students are safe and continue to learn, and look forward to working with schools to make that happen. Thank you.
Thank you, Ann. And I want to thank you, your team, and the Education Task Force, the Continuous Learning Task Force, for the work that you've done to reimagine education for Iowa during this challenging time. It's really important that we continue to engage students regardless of these extraordinary circumstances, and I appreciate your leadership in this effort. I also want to just say a big thank you to Iowa's teachers. I know this is a difficult time. As a mother of a teacher, I know how much she misses being in the classroom with her students and wondering how they're getting along. So I know that your students are on your minds as well and in your hearts. Iowa schools are among the best in the country, and even now, in this time of extreme difficulty and challenging times, I believe that we can still shine and make sure that we're providing every opportunity for continuous learning for our students. And I think, are you speaking at this? Yeah, at this point, I'd like to turn it over to Dr. Padati to give some remarks.
Thank you, Governor. I want to start by acknowledging again that we know this has been just an incredibly difficult time for everyone. And I am so grateful to everyone across Iowa who has done great things like staying engaged in public health, following the recommendations that we've been making, and sharing those messages in our communities with our families and friends, because those are really important things to do, and we need to continue to do those things. I wanted to talk a bit more about some of the ways that we're able to use data and information that we learn as we continue to respond to this COVID-19 outbreak. Just like with any new illness or any new thing, we have a framework that we use, lessons from previous epidemics or previous pandemics or other viruses, and we integrate new knowledge as we go along. And so part of what's very important about a response like this is not just, as you've heard, that it's an all-of-government and multidisciplinary approach, but also that it's flexible, because it's important that we remain able to adjust over time. And in part, how we do that is by looking at the information we have and understanding its impact as we move along. And so I think you've heard us talk in the past about some of the metrics or some of the ways that we assess COVID-19 activity and its impact here in Iowa. I want to talk a bit today about how we do that. I think, as you've heard before, some of the things that we're looking at include things like the percentage of our population over 65, which again is going to give us an idea of who our vulnerable community members are, our grandparents and others in the area. We also look at things like long-term care facility outbreaks, and it's important to keep that in mind because we've seen the experiences of other countries and other states and how challenging it can be to care for those populations in those situations, and so we want to be particularly careful and supportive of them. We also look at things like the rate of cases, so the number of cases per 100,000 over a time period. In this case, 14 days, which is an incubation period for this virus. And that helps us think about the activity of the virus in recent days. And then we also look at the percentage of Iowans who have been hospitalized because of this virus, and that helps us understand the severity of this illness. Now, these are just some of the metrics that we use to help us assess COVID-19 activity, and as you've heard before, we're doing this on a regular basis throughout the day. We're doing it across the state and in partner with our local public health and clinical partners at a variety of levels. We're going to continue to look at metrics like this. We're going to continue to work with a lot of our great partners and resources throughout the state of Iowa to adjust and remain flexible in our response. And I want to say thank you to all of the businesses, schools, and of course our healthcare workers, all of the people who have helped us implement the measures that we've recommended, and to all Iowans who are following the guidance that we give, which is so important to do. And again, it's important that we continue to encourage each other in our communities to follow those steps, which do continue to include covering your cough, washing your hands frequently, and really staying home when you're sick. Thank you.
Thank you, Dr. Padati, and I just appreciate so much you and your team and all of the time and effort that you will have put into really making sure that you're providing us with the best metrics and best data possible to make the decisions that we make as we move through this coronavirus pandemic. So just a heartfelt thanks to everything that you're doing. I appreciate that. And with that, we'll open it up for questions.
Governor, just a couple of quick things. Could first have someone explain what the math means, like the little numbers and how you figure out those metrics and what they mean in light of how you make determinations of response? And secondly, for you, Governor, if you could just respond to increasing pressure from congressional delegation, legislative leaders on the Democratic side, obviously, and other folks, wondering why you haven't taken the extra step of a shelter in place, given the fact that I think Iowa is one of only 5 states now that hasn't done that.
Yeah, well, in a sense, we've put a lot of the measures into place. I've just done it in an incremental fashion, and I've done it based on data. All throughout this process, I've said that I have worked with the Department of Public Health, the epidemiologist team. They've worked in conjunction with the CDC and other assumptions that they put into the into what they're looking at to provide their recommendations recommendations to me. So on March 15th, I recommended schools close for 4 weeks. On March 17th, I issued the public health disaster that closed bars and restaurants, casinos, ordered that social gatherings be no larger than 10. On March 22nd, I added additional businesses and suspended non-essential services. So my challenge, I guess, to individuals out there that think I haven't done enough, I would ask them to go and take a look at other states and the recommendations that they've put in their stay at home. I don't care what you call it. I'm basing it on data. And as Dr. Badati said, and I'll have her walk through the data, we need the flexibility because we can identify where some of the hot spots at. Is it in a region? So we can focus in and make sure that we're getting the equipment there. We have the workforce. We have the surge capacity in place so that we don't overwhelm our hospital systems. Look at the long-term care facilities that are in that area. If you look further west, their numbers aren't near where they're at maybe on the eastern side of the state or the north or the south. And that will allow us, she also talks a lot about dialing up and dialing down. And so the more that we can base it on data and be responsible in our decisions, then it allows us to have some flexibility to continue to not only address the supply chain, but to make sure that those essential workers that are on the line know that they're appreciated and feel comfortable continuing to come to work. So I would challenge other Iowans out there to take a look at what some of the other states are doing. Take a look at what we've done in Iowa. I've extended most of them through April 30th, and then we have additional things that we're looking at that we may need to ramp up if the numbers and the data drive us to do that. Dr. Padati?
Yeah, so when you look at this map, you'll see Iowa that's broken into several different regions. And when we think about how to do that, we actually began by looking at the regions that correspond to patterns of healthcare utilization. So we were able to use existing information to help us understand what resources exist to seek healthcare and what are the patterns that people typically use to do that. And so the region divisions are based around our resources and what's available, because that's what we're going to use to respond to or to care for people who are affected by COVID-19. And so then when we talk about the measures that I've listed for you, those variables about percentage of population over 65, long-term care outbreaks, the rate of cases, and the percent hospitalized, we look at each of those and assign them a score, and then we look at that score day by day and usually multiple times a day to help us understand the activity level and trends and patterns that we see across Iowa. And as you've heard before, we use that to help us either move up or down on some of the public health mitigation measures that we have available to us. And one of the things that I think is really important to keep in mind is that these mitigation measures are effective as long as we all follow them, right? And so everything we can do to encourage the people in our lives to adhere to standing 6 feet away from me, making sure you're frequently washing your hands. If you don't feel well, please do stay home. And making sure that we make it as easy as possible for folks to follow those measures is really important. And again, as I mentioned, we look at information that feeds into those metrics and helps us understand an assessment of what's happening across from Iowa. But that doesn't mean that we aren't going to act at certain times. In fact, all the time we're using the information that we get to reach out to partners and work with people who let us know that they have concerns or need support. And so it's a very ongoing, very flexible approach, and it needs to be, because we're going to continue to learn more about this. And part of our success in this in Iowa is really going to be about continuing to work together on this.
Dr. Padati, are those numbers up there based on that 1 to 10 scale that was released in those documents today, where at 10 is sort of the precipice on releasing a shelter-in-place order, in which case Eastern Iowa would be closest on that?
Yeah, that's right. So there are ranges built into these score assessments. And again, I would say it's an example of a place where we remain flexible. This is good information that we receive throughout the day and look at constantly to help us understand what's going on. And it's something that we remain able to adjust if we need to. And so we certainly work both, sort of at a more focused level, if there's a particular like facility level or local level concern, and then looking broadly at what's going on activity-wise and what resources we have available to help people. And you're right, if you look at this map and look at the case map of where we've seen cases, they'll look a little similar, and they should, right? This helps us understand the activity levels, where we need to focus our understanding and our resources, and again, just remaining flexible in our response is important for this.
One more for you, Dr. Pedati. The University of Washington model that's out there, I know yesterday the governor and Sarah did say there were some disputes with that, but it's now saying 1,488 deaths potentially by June 1st. Is that a reasonable number for what could happen?
Yeah, I think that, again, this is an example of a place where we have to recognize we use what we know about the experience in other places and experience around other viruses. And so that's what largely has gone into something like a model. And models are great, and they're important, and they're helpful for us to try and understand what might lie ahead. But they can be challenging, right? Whether we're talking about predicting the weather in a month or whether we're talking about predicting the stock market, there's a lot of variation that can go into those kinds of things. And so models are good, and it's helpful to know sort of where we may be headed, but we have to keep in mind the data that's going into them. And as we get more information about what's happening here in Iowa, it's helpful for us to look not just at global or national models, but at what we know about what's happening here locally in our state. And then I think the other thing I would add is with any outbreak, we always kind of do two things, right? We're always looking ahead, we're always looking at the data, but we're always recommending the control measures that we know are going to help. And in this case, it's really those social distancing measures and talking about staying home when you're sick, washing your hands, and those basic measures that everybody can do to help reduce the spread of the virus.
Last question before we go to the phones, Natalie.
Yeah, Governor, I was wondering if you might waive school spending limits so that, districts can use reserves to kind of extend the school year if they need to.
Well, so right now, we'll take a look at that moving forward. My hope is that all of them will participate. I think we've made it very flexible for schools to participate either in the voluntary or the, what's the other one called? Required. And so if not, then some of the stipulations for the time elements based on what's already been taken off the table that's been waived for the existing closures. So, that's something that we'll look at as we move forward, unless, Ann, you've got anything else to add to that.
No, I would just add that I know there's a lot of questions about what this is going to look like, and we have a meeting scheduled with school leaders at 4 o'clock. We're going to address some of these concerns, and we're also going to make sure we're asking about what their additional questions are. Finances are a big part of that, and we have a team at the department that's looking at what those options might be, considering lots of different factors. So again, we're trying to be as flexible as we can be, knowing that there's a lot of unknowns, and we want to try and hold harmless not just our schools, but also, most importantly, our students.
Caroline Cummings, go ahead.
Hi, Governor. I guess this is a question for both you and Dr. Pedati. Now that we have more information about this, assessment of the points that you're allocating to the region, I'm wondering if you can explain why you're still heeding to data points related to long-term care facilities and people who are older than 65, when we obviously know this virus is infecting people regardless of their age, and that, middle-aged adults are still dying from this virus, and, younger Americans can, be on ventilators long term. So why are we still sticking to these data points when assessing needs?
Yeah, thank you for the question. So again, part of this goes back to understanding who we know have more severe outcomes, and that's still people who are older and people who have underlying health conditions. It also goes to our understanding of how viruses like this have behaved in the past. So when we look at things like SARS and MERS, we've seen them affect healthcare settings. And so if you think about a long-term care, you've got essentially a healthcare setting with people who are older and who have underlying conditions. And they're living together. And we also know that living together with other people in general, puts you at higher risk for spreading illness. And so the reason for paying close attention to something like that is because, again, we're really trying to focus on our vulnerable populations, how we can protect them, and how we can support the people who take care of them. And so when you talk also about the age changes, in part, I think that we're seeing some of that related to underlying conditions, which is also why we look at things like percent hospitalized, which helps us understand severity of illness. And I think we've also seen that a bit as we've looked at people who take care of people in these settings, right? So our healthcare workers. So again, I think what we're trying to do here is recognize where we've seen the higher consequences for this virus so that we can understand its activity, understand where to direct our resources, and also understand that, again, there's a role that all Iowans can play. Some people are going to get mildly ill with this virus, and so staying home, staying away from other people, even if you just feel that you have a little bit of a cough and a sore throat, is really important to do to help protect yourself, the people around you, and the ability of this virus to move in Iowa in general.
Rod, go ahead.
Thank you, Governor. Looking at the economy, are you concerned that the state tax collections could erode to a point where the budget surplus could turn into a situation that requires some kind of corrective action yet this fiscal year? Are you making contingency plans that include federal rescue money, and do you expect to have to start over with a new state budget plan for fiscal 2021?
Yeah, we're meeting with David Roeder, who is the director of the Department of Management, and our fiscal team on a weekly basis. Dave was in the other day. In Iowa, we have, manufacturing a greater percentage of our GDP. The greatest percentage is manufacturing, and so because we're part of the supply chain and food production, we're seeing those numbers hold pretty steady. We entered into this. Iowa's fiscal health was strong and healthy. Our cash reserves are full. We had almost a $300 million surplus at the end of fiscal year 19. We were going into 21 with a very healthy state fiscal finances, and so we're in a good place, but we're not going to be like other states. We're going to be impacted, and so we're going to continue to see that. And he's got metrics that he's looking at and reporting out, and we're working with other agencies across the state too to monitor the Rebuild Iowa Infrastructure Fund, for instance, is something that we have to continue to monitor. Some of the funding that goes in that comes from casinos, and so we've shut them down. So of course that will have an impact as well. So we're looking at specific agencies. We're monitoring budgets, we're and monitoring cash flow, as well as revenue coming in. So of course the Department of Revenue is a big piece of what we're watching too, as we're extending deadlines, and so we'll continue to keep an eye on that and adjust as we need to. We're very grateful that we are entering into this pandemic with a very fiscally healthy state budget.
We got time for two more questions. Ron from KWWL.
Good afternoon, Governor. Thanks very much. What I'm hearing you say again fairly strongly today is that you believe your mitigation strategy is working, that you're content that 614 positive cases, 11 deaths is about where you thought you'd be by this date, April 2nd. But as people have said to me, why not err on the side of caution now rather than perhaps have some major regrets later if there is a surge?
I can start that, and then I'm going to turn it over to Dr. Pradati. She can walk through some of the metrics we've used and why that makes sense. But we have all along really put in place restrictions and orders based on the data that we have, and I think we're starting to see the response from that. As we learn more and we take a look at other assumptions and data that's available, we'll continue to monitor the situation. But again, I would ask other Iowans and you to look at what we've done and what other states have done, and I'm not sure why and when they did what they did. I know that I've based my decisions on data that's been provided to me from the epidemiologist team, the Department of Public Health, working in conjunction with the CDC and other experts across the country. So, Dr. Pradati?
Yeah, thank you, Governor. I think the other two pieces to keep in mind, again, whenever we have something new, we take what we know from other experiences, from other viruses, and we integrate new knowledge as we go along. And we're going to keep doing that, and I can't emphasize enough how important flexibility for all of us and all of our partners are in this response. And I think you've seen, that we've all been doing that as we've moved along. One of the things that I think we recognize about this virus is that it's spread through droplets when people are in close contact, right? So within 6 feet, somebody can cough or sneeze, and those will land on the mucous membranes of other people, and that's primarily how we're seeing this move from one individual to another. And we're also seeing that there seem to be people who live together in whom it spreads quickly, and in the healthcare setting that seems to be a risk. And so what we're trying to do is take into account what we're learning and how to target our efforts and target our resources so that, again, we protect the people for whom the consequences of this illness are highest, and we preserve the workforce of people who are caring not just for these patients, but for all Iowans. And so I think keeping that in mind is important. I think the other piece to keep in mind is that when you think about the use of public health mitigation strategies, which is what we have right now while we await additional tools like medications or vaccines, these strategies have to be put in place carefully and consistently in order for them to be effective. And so in some ways, it wouldn't be enough if somebody, just sort of stopped in place for 2 weeks. What we would do in that situation is delay a peak. And what we're trying to do is flatten that peak. It's not that I want to push it out, it's that I want to keep as many people as healthy as possible for as long as possible. And so that's in part why we think about using the strategies we have, and also why I know this has been a hard time for everybody, but it is so important that we all remind each other, wash our hands, cover our cough, and stay home when we're sick.
Last question is going to go to Kay Henderson, Radio Iowa.
Governor, how many of Lynn County's deaths are linked to the nursing home where you announced earlier this week an outbreak has occurred? How many of Lynn County's total COVID cases are now related to that nursing home? And how many other facilities in Iowa have you identified as having an outbreak?
Sarah, do you have that? Yeah. I think it's 4, but I'm not sure. Okay. I just want to verify I'm getting the right data.
No, I thank you for the question. As with anything, and I know many of you have heard me say this before, as with any sort of infectious disease response, we have certain public health laws that we follow and certain things that we hold confidential and protect. And so we have shared some information about cases that are associated with this facility. We're, in close contact and regularly supporting this facility, but I don't think I have anything additional to add at this time.
Okay.
Thanks.
Okay, thank you. Thank you.